Hello and welcome to my channel. I'm Dr. Shivika. This is my second video on buzzwords for infectious diseases. If you have not watched the first video, make sure to watch that too. That has been posted on my channel last week. Now these buzzwords or keywords are those words which, if present in the question, it may be an MCQ or it may be your university exam, they can help you quickly and efficiently clinch your diagnosis and save a lot of time. So let's get going. So if we have a young female who has presented with frequency, urgency, dysuria, and many a times it is mentioned she's been recently married, that means this is honeymoon cystitis. The first organism we're going to think of is the uropathogenic Escherichia coli. And if the question asks us which is the gram-positive agent, then we're going to think of Staph saprophyticus, which is a coagulase-negative staphylococcus, and it is resistant to novobiocin. UTI in a patient with an indwelling urinary catheter, the likely agent is again uropathogenic Escherichia coli. Now remember that more than 80% of urinary tract infections in the world may be a male or a female, any age, any community acquired infection, or in a hospital acquired UTI, it is Escherichia coli. A urinary tract infection associated with the formation of strew-white stones, we will think of Proteus, because Proteus are urease producing organisms which lead to persistent alkalinization of urine, leading to the deposition of strew-white stones in the urinary tract. Meningitis and HIV, the first organism that should strike us is Cryptococcus, a true yeast which is seen on negative staining using India ink in the CSF. Neonatal meningitis, the organisms responsible are Escherichia coli most often, followed by group B streptococcus, which is a catalase negative gram-positive coccus seen in chains, which is CAMP test positive. And the third organism is Listeria, a gram-positive rod having tumbling motility and differential motility. Infective endocarditis in an intravenous drug user, the most common agent is Staphylococcus aureus. Early prosthetic valve endocarditis, that is, endocarditis developing within 12 months of the valve surgery. The most common agents are the coagulase negative staphylococci, but if it is a single species, then it is Staphylococcus aureus. So remember, the most common as a group is the cons, but that's so many species of staph, but as a single species, it is Staphylococcus aureus. Prosthetic valve endocarditis presenting beyond 12 months of surgery, the most common organism is the viridans streptococci, which are the alpha hemolytic gram-positive cocci in chains, which are catalase negative. A patient with a swelling in the jaw, and on microscopy we are seeing branching rods, that is, which are gram positive, very slender. The likely agent is actinomyces species causing actinomycosis, that is cervicofacial actinomycosis, also called as lumpy jaw. A disease associated with rat urine, rice fields, and rainfall. It is leptospirosis caused by Leptospira species. Facial nerve palsy in a hiker or a camper. The most likely diagnosis is Lyme's borreliosis caused by Borrelia species like Borrelia burgdorferi, Borrelia garinii, and Borrelia afzeli. Encephalitis which is presenting with symptoms localized to the temporal lobe, is most likely caused by herpes simplex virus, and more than 95% of this herpes encephalitis is caused by HSV1. An HIV patient presenting with encephalitis, and on MRI we are seeing ring enhancing lesions. The likely agent we are going to think of is Toxoplasma gondii. Meningoencephalitis developing soon after swimming, we will immediately think of the protozoa Naegleria fowleri. Retinal hemorrhages and exudates in an HIV patient, that is called as pizza pie retinopathy or cottage cheese and sauce appearance on ophthalmoscopy. It is chorioretinitis due to cytomegalovirus. Acid-fast structures seen in the stool of an HIV positive patient with diarrhea. We will think of coccidian protozoa, Cryptosporidium most commonly, followed by Cystoisospora and Cyclospora. Rice water stools are seen in cholera due to Vibrio cholerae. Diarrhea in a traveler, that is traveler's diarrhea. First organism is enterotoxigenic E. coli, which produces the heat labile toxin and the heat stable toxin. Diarrhea following the ingestion of hamburgers or beef burgers, the organism likely is enterohemorrhagic E. coli. Bloody diarrhea associated with or complicated by acute renal failure, thrombocytopenia, and microangiopathic hemolytic anemia. That is diarrhea associated with hemolytic uremic syndrome. The likely agent is E. coli O157H7, considered as the most dangerous strain of enterohemorrhagic E. coli. Bloody diarrhea, and in the question they are talking about that on sorbitol McConkey medium, pale colonies are produced. The likely agent is again E. coli O157H7, which is the only strain of E. coli which does not ferment sorbitol. Diarrhea following the ingestion of Chinese or fried rice. The diagnosis is emetic type of food poisoning due to Bacillus cereus. Diarrhea, which is complicated a couple of weeks later by symptoms of Guillain-Barré syndrome. It is likely to be caused by Campylobacter. Diarrhea following the ingestion of mayonnaise or potato salad or pastries or eclairs. The diagnosis here is staphylococcal food poisoning caused by Staphylococcus aureus. Diarrhea following ingestion of refrigerated food is likely to be caused by Listeria monocytogenes, which is a psychrophilic organism that can grow at refrigerator temperatures. Diarrhea following the ingestion of soft cheeses typically used in pizzas is likely to be caused by Listeria monocytogenes. Infantile diarrhea, the most common organism is rotaviruses, that is the wheel-shaped viruses belonging to the family Reoviruses. So if you liked my video, don't forget to press the like button. And if you have not subscribed yet to my channel, don't forget to press the subscribe button and also press the bell icon so that you can get the notification whenever I post my next video to make you love microbiology. Bye bye.